Hey there everyone, Dr. Parker here. I'm just going to walk you through some important information about getting ready for your general medical experiences and then also what's expected of you while you're there. Where to find information? One, Blackboard site. Of course, it's the Blackboard site. We're going to go clinical documents right over here, and then we're going to go down here to general medical documents. The first two are telling what you need to know. Note orientation documentation. This is a simple PDF. We got screenshots to help you along, a live link over here in order to tell you the specifics. You'll log in. There's a host of documents there that you'll need to look at. Click on each one. It'll open up separately. Once you have everything cleared, you'll contact Kristen Ireland. She is the charge of all medical volunteers, or all volunteers period, for the entire hospital. All documentation for clearance will come from her, not from me. Now, Metro Health, Drs. Kern, Cornoli, and Hinckley. These documents are all here for you. Criminal record check, internship, all of these things are here. This mandatories one is a pretty big document, so I want you to know that before you start downloading. You do need to look it over and make sure everything is at least 2 weeks in advance of the placement. Great thing for you, much of the health vaccine information is downloaded from Castle Branch and will just need to be forwarded. All right. Hours. All students will complete around 225 hours, which is an average of 15 hours for 15 weeks. Please recognize that this is an average. It's the whole semester that we're talking about here. Some weeks will be a little higher, some weeks will be a little lower, and that's fine. Now, the general medical is 50 of those 225. If you don't get all 50, that's okay. Please get as close as you can, and we can complete the rest in the summer or even in the next semester, provided it doesn't overlap with an immersive experience. Everyone can gain hours at North Ottawa Community Hospital Emergency Department. Some have been assigned to Metro Health. Obviously, the doctors can't have a whole bunch of people in their clinic, so that's a very few number. Everyone, however, can go to North Ottawa Community Hospital, provided you've been cleared by Kristen Ireland. So what is it that I'm hoping you'll gain out of this? Well, there are two standards that are particular for this set of experiences. Standard 17, a program's clinical education is planned to include clinical practice opportunities with all different kinds of patient populations. Patient populations must include lifespan, everything from a baby to an elderly person, different sexes with different socioeconomic statuses, of varying levels of activity, and who participate in non-sport activities. All right, so we're going to see a lot of non-sport when we're talking about North Ottawa Community Hospital. The second standard is the next one. Students gain experience with patients with a variety of health conditions. Not everything is a sprained ankle or a separated shoulder. We need to be experiencing a wide variety of health conditions. Athletic trainers routinely practice in one of a bunch of different areas. Urgent care, primary care, sure, orthopedics and rehab are what most of us think of, but we also deal with behavioral health, children, performance. There's a host of different areas. So the experience provides students with opportunities to engage with a whole host of conditions, cardiovascular conditions, neurological, genitourinary, gastrointestinal, environmental conditions, all of it. And you're going to see that in a primary care physician's office, and you're going to see that in an emergency department. So that's what we're really after here. These are the two standards that we are paying attention to. Now, this is not a traditional clinical site where you're expected to get hands-on, but observation is an active process. Do not become a wallflower. You will not get anything out of the experience. Observation skills. Clearly the instruction, look, observe, see this, see what? Observation is selective. It needs a chosen object, a definite task, an interest, a point of view, a problem. It needs to be directed. Who am I observing? What am I observing? For what purpose am I paying attention to this? So I am going to help you to build observation guides. You should have a target, a focus, a finding. Every encounter should have a target, a focus, and a finding. What's a target? What am I paying attention to? The patient, the clinician. Maybe I'm paying attention to how they interact. The focus of my attention, the patient's condition, level of impairment, Maybe I'm actually paying attention to the interactions between healthcare providers. The potential here is really long, but you should know it before you go into that encounter. And you need to have a finding for your observation. So I have a focus as I go in. I target and a focus as I go in, and a finding as I come out. Maybe I'm going to make a report. Maybe I'm going to interpret signs and symptoms and come up with a differential. Maybe I'm going to analyze the information presented by the patient, and I'm going to make a recommendation for a treatment. Interactions between healthcare professionals can also be the finding. Like, wow, did you see the interaction there between the respiratory therapist and the physician assistant? I don't know. The list is long, and it is going to be based on the encounter type. It's going to be based on your plan. So I'm going to give you a couple of examples. Patient presents pain in the leg. Okay, that's all you got. They got a pain in the leg. So I am going to focus my attention. I'm going to choose to focus on my target on the patient, my focus on the presenting signs and symptoms. And as I come out, I want to be able to interpret them. I want to be able to build a differential diagnosis and interpret what the findings are. What do I need to do after that? Well, the follow-ups are going to be the host of questions that come as a result of that encounter. If I have a patient, presenting with signs and symptoms, I think maybe it's an infection. How do I interpret that based on the signs and symptoms? And what do I need to do that as a follow-up? Who else in the healthcare team should be involved? How might this infection impact sport participation? Okay, what kind of infection? Is it bacterial, viral, fungal? What type of differential there, and how do I come to a conclusion? So those are the kinds of follow-ups that you're going to be asking. Here's a second. Maybe I've got somebody in the ED and the physician's doing an evaluation for suspected brain injury. Focus on the attention, the physician, the focus on cranial nerve assessment or some other evaluation tool that they're using. And by the end of it, your takeaway is how the assessment of that cranial nerve relates to the other signs and symptoms the patient is presenting. Follow-ups include, maybe it's the follow-up is I need to review my cranial nerves. Maybe I'm going to demonstrate a good assessment to my preceptor later. How various neurological conditions would change based on the findings. So there's a host of follow-ups that could come with this. So those are just a couple of examples. How do I develop my own encounters? I'm going to go in. How am I going to do this? Well, start by taking a few minutes to learn who the patient is that you're about to encounter. One aspect of their evaluation, one aspect of the treatment plan or diagnostic testing that's gone on or is planned that you want to learn more about. You could also think about a shift theme, if you will, like I'm going to pay attention to all diagnostic testing done on all patients today, or I'm in the doctor's office and I've got a bunch of pediatric patients and I need to think about child development and how they're able to interact with the doctor. So there's a host of things that you could think of as maybe even a theme for each shift that you're observing. Develop and write them down. All right, you're going to report them later, so write them down now. During the observations, take notes. You have a target, you have a focus, you know what finding is that you're looking for. Now, phones are never allowed. Not in the physician's office, not in the emergency department. Leave it in the car. But paper and pens are. Be respectful of your HIPAA rules here. But paper and pens, develop your own system for taking notes and record it all. After every shift, you're going to go into HRAC forms, general medical observations, describe your observation guide or what your theme was. Give me your target, your focus. Describe the patients, what conditions did you observe, and how did the healthcare team interact on that? Describe the interactions you had with those healthcare professionals, and what new skill or information did you get out? What are 2 follow-ups or questions that you had from your observations? Okay, these are the things that are focused. You got a target, you got a focus, you have a finding, and I want to see you using this set of skills to build your active observation. All right, get out there and have fun.